Have you ever felt like you're living in a state of emotional twilight, where some days you feel okay, you get things done, you feel pretty good, even hopeful, but most of the time joy seems fleeting, and even the simplest tasks like getting up and going to work or school, calling a friend, or answering an email feel like monumental challenges? If this sounds like you might be experiencing dysthymia, a mental health condition often shrouded in mystery, yet profoundly impacting those who experience it. Hi, and welcome to The Inspired Therapist, where we blend science, a little mysticism, and psychology to encourage you to optimize your mental health. Today we are going to define dysthymia, talk about who is more likely to experience it, and how it is treated so you can feel free from its grip on you. To an outsider, an individual with dysthymia may appear to have a pretty good life, one that seems ordinary, even productive. Yet for those with dysthymia, each day can also feel like a gloomy cycle of emotions. There are moments where one feels uplifted. You go to work, you get things done, you socialize a bit, and life looks okay. But it's kind of like you're doing all of this on autopilot. And then there are days you might feel blank or numb, as if your emotions have been stripped away, and mundane tasks like making breakfast for yourself are done with a sense of tiresome heaviness. If this is your experience, you know firsthand the nuanced nature of dysthymia, or what's now more commonly known as persistent depressive disorder, chronic depression, or high-functioning depression. And you know how difficult it can be to understand yourself or even explain to others. You may have just thought that you had depression, and it got a little better, but not much better. So where does the term dysthymia come from? Its roots can be traced back to ancient Greece, where dys means difficult or ill, and thymia refers to one's mood or spirit. In essence, it reflects a persistent state of low mood rather than just occasional sadness. According to the DSM, the diagnostic tool we use to define psychiatric conditions, dysthymia or persistent depressive disorder is characterized by a depressed mood that lasts for most of the day, for more days than not, and for at least 2 years in adults or 1 year in children or teens. Additionally, individuals with dysthymia experience at least 2 of the following symptoms: poor appetite or overeating, insomnia or hypersomnia or oversleeping, low energy and fatigue, low self-esteem, poor concentration, and feelings of hopelessness. It wasn't until the late 20th century that dysthymia gained recognition within the psychological community due to the efforts of pioneering psychologists like Dr. Gerard Klerman, who also co-developed interpersonal therapy. Dr. Klerman stated that PDD represents a distinct form of depression due to its prolonged duration and milder yet persistent symptoms. It often emerges in early adulthood and can last for years if untreated. Dysthymia affects approximately 4% of the population. That means 320 million people in the world may be affected, even you. Here are some other interesting facts about it. People of all ages, races, and genders can develop it. However, women are more than 3 times more likely to experience the dysthymia than men. The triggers for depression between the genders appear to differ, where women more often present with internalizing symptoms or feelings experienced inwardly, like anxiety, loneliness, and negative views toward oneself or one's body, and men presenting with externalizing symptoms like anger or impulsivity. Hormonal changes throughout a woman's life may also contribute to higher rates of persistent depression. This certainly does not mean that men do not experience it. It just may manifest differently. People with dysthymia are also more likely to have first-degree relatives with the condition. So if your mom or dad has experienced it, you may as well. More than half of the people with it will eventually have an episode of major depression, which is a stronger form of depression. And some patients who recover partially from major depression will have milder symptoms that persist for years. In other words, their depression evolves into dysthymia. Like major depression, dysthymia has roots in neurochemical imbalances in the brain, childhood and adult stress and trauma, especially chronic stress or complex trauma, and social circumstances, especially isolation, loneliness, and the unavailability of help such as counseling or psychiatric services. Many therapists like myself find that people who hold certain beliefs about the self, the world, and the future are also more prone to dysthymia. In other words, pessimistic people may be more susceptible to it. Some also believe there are deeper or metaphysical aspects of dysthymia. According to spiritual teachers like Eckhart Tolle, this condition often arises from unresolved emotional traumas and disconnection from one's true self. Tolle has said that it is like a shadow that follows us when we refuse to confront the pain and suffering buried within our hearts. It's a call to heal the wounds that bind us to the past. So what are the treatment options for dysthymia? From a traditional psychotherapy to innovative approaches, there are a range of strategies to explore. Cognitive behavior therapy, or CBT, remains a cornerstone in managing dysthymia, helping individuals challenge negative thought patterns and develop healthier coping mechanisms. A different approach may come from therapists who practice within the realm of psychodynamic methods. Central to psychodynamic theory is the concept of the unconscious mind, where repressed emotions, memories, and desires reside. Through techniques such as free association, dream analysis, and exploring transference and countertransference, psychodynamic therapists aim to bring these hidden elements into conscious awareness. In addition, psychodynamic therapy often delves into a person's early life experiences, particularly relationships with their caregivers and significant others. By uncovering patterns of behavior and thoughts rooted in childhood, clients can gain insight into how past experiences are shaping their present emotions and behaviors, confront these beliefs, and make active changes toward living in the now rather than the past. For those seeking alternative interventions, transcranial magnetic stimulation, or TMS, offers non-invasive techniques that target specific brain regions implicated in mood regulation. By stimulating these areas, TMS can alleviate symptoms of dysthymia and promote emotional well-being. Additionally, emerging research suggests that certain nutritional interventions may complement traditional treatments for dysthymia. Foods rich in omega-3 fatty acids, such as salmon and walnuts, have been shown to have mood-stabilizing effects, while supplements like vitamin D and folate may support overall mental health. While the journey of living with dysthymia may seem daunting, it's essential to remember that healing is possible. By embracing a multifaceted approach that addresses the mind, body, and spirit, individuals can not only manage their symptoms, but also reclaim their sense of vitality and joy. Research shows that 70% of those who sought support for dysthymia recovered within a couple years, especially if they can continue doing what made them feel well. I want you to know that healing is not just a possibility, it's a reality within reach. If you lived with it, dysthymia can feel like a heavy shadow that's always looming, but it doesn't have to feel like a life sentence. Treatment works. And though the journey may have its ups and downs, every step you take forward is a victory worth honoring. Thank you for watching The Inspired Therapist. If this content was helpful to you, please like, share, and subscribe to this channel.